One of the most common physical complaints is shoulder pain. Your shoulder is made up of several joints combined with tendons and muscles that allow a great range of motion in your arm. Because so many different structures make up the shoulder, it is vulnerable to many different problems. The rotator cuff is a frequent source of pain in the shoulder. Internal rotation shoulder impingement specifically is caused by rotator cuff pain. When you rotate your arm inward, the space between the acromion and rotator cuff narrows. The acromion can rub against or impinge on the tendon and the bursa, causing irritation and pain. Overuse of the deltoid and weakness with the primary internal mover in the shoulder, the pec major, are areas of concern when dealing with internal rotation impingement. Rotator cuff pain is found in all walks of life, from youth athletes to sedentary middle-aged people, and everyone in between. Those who do repetitive lifting or overhead activities using the arm, such as paper hanging, construction, or painting, are also susceptible. Pain may also develop as the result of a minor injury. Sometimes it occurs with no apparent reason. Symptoms of rotator cuff impingement are commonly caused local swelling and tenderness in the front of the shoulder. You may have pain and stiffness when you lift your arm. Normal range of motion within the shoulder should be 90 degrees. Anything less than the ability to go 90 degrees could be an indicator of internal rotation issues in the shoulder. There may also be pain when the arm is lowered from an elevated position. Beginning symptoms may be mild. Patients frequently do not seek treatment at an early stage. These symptoms may include minor pain that is present both with activity and at rest, pain radiating from the front of the shoulder to the side of the arm, sudden pain with lifting and reaching movements. Athletes in overhead sports may also have pain when throwing or serving a tennis ball. As the problem progresses, the symptoms may increase. Pain at night, loss of strength and motion, difficulty doing activities that place the arm behind the back, such as buttoning or zippering. If the pain comes on suddenly, the shoulder may be severely tender. All movement may be limited and painful. In circumstances with loss of range of motion, measurements are available to determine the severity of the internal rotation shoulder impingement. The goniometer measurement tool is a great way to determine range of motion capabilities for a client. Have your client in a supine position with their fists in the air at a 90-degree angle. The axis of the tool should align with the elbow. Have the client rotate their arm while in a 90-degree angle still toward their inferior direction. Once the client has reached maximal range, determine the degree they can go to. Once it has been determined the client has a range of motion impairment with the shoulder, manual muscle assessment should be implemented to see the cause of the pain. One test that can be utilized in the MMT assessment is the NIR test. Have your client in a sitting position and manually shoulder depress the scapula. Internally rotate the arm with their thumb pointed down. Have their arm elevate, straight-armed, and determine their range. Passing the test is determined by no pain in the shoulder area. If there is pain, there is subacromial issues that need to be addressed. The next manual muscle test is the Hawkins test. Have your client in a sitting position, shoulder flexation at 90 degrees. Rest on one arm and push down on their wrist 90 degrees, passing zero pain in the shoulder failure is again subacromial issues that need to be addressed. When addressing a client's rehabilitation to shoulder impingement, utilization of the corrective exercise continuum is imperative to the long-term success of the client's health and recovery. The first stage of the continuum is the inhibition stage. This stage allows for the cessation of activity in the shoulder to allow for recovery. This technique of inhibition has a purpose of decreasing neuromuscular activity. Use a foam roller to roll out the muscles that are overactive. These muscles include the upper trapezius, latissimus dorsi, pectoralis major, and deltoid. Utilize the foam roller 30 seconds each muscle. The second stage in the continuum is the lengthening stage. This stage allows for stretching tight muscles and allows for a technique of extensibility. The 90-degree door frame stretch is a great stretch not only for athletes, but anyone with internal impingement in the shoulder. Have the client standing next to a door frame or any sturdy wall. Have them in a cocked 90-degree angle and place the forearm on the wall. Slowly stretch the shoulder by pushing slightly to feel the stretch. Perform the 90-degree door frame stretch with 3 sets of 15-second holds. Another stretch that can be performed is the pull-up hang. Simply have your client hang in a pull-up, relaxing the shoulder and having the deltoids stretch out. This stretch is great not only for relieving tension in the deltoid, but cervical spine as well. Have your client perform this activity with 2 sets of 30-second holds. The third stage in the continuum is the activation stage. This phase allows for techniques to re-educate underactive tissues. The key in the activation stage for the client is to activate the subscapularis. An exercise to perform activation in the subscap is the 90-degree band internal rotation adduction. The patient is to stand with the band attached to a wall or doorknob. Distance from the wall allows for greater tension the further you move from the wall. Have the patient's elbow in a 90-degree angle. Internally rotate the shoulder toward the chest while maintaining the elbow in the stationary spot at the midribs. Have the client perform the band induction exercise 3 sets of 12 repetitions. Another exercise to perform in the activation stage is the transition dumbbell press. This rotator cuff exercise is to be performed with very low weight, as the rotator cuff is not a strong isolated muscle. Have the client perform an upright row to 90 degrees. Then have them externally rotate their shoulder upward into the beginning of a shoulder press. The client then presses into the air. After the press, they then lower the dumbbell back to the start of the press. They then internally rotate their shoulder back down and essentially back to how they originally started the exercise. Through every stage of the exercise, the client is to not rush each movement and maintain a 90-degree elbow on both sides. Perform this exercise 3 sets of 8 repetitions. The final stage of the corrective exercise continuum is the integration phase. The purpose of this stage is to provide techniques to retain synergistic function in the shoulder. This stage provides a culmination of all the previous work the client has done with you and is ready for dynamic exercises. Cable-weighted punches provide internal and external movement functionality. Have the client in a stance where the working arm is used opposite the plant foot. Have the client start with the fist and cable in hand at the hip. They must start with a supinated grip, but follow through with a punch that turns into a pronated grip. Have the client perform this exercise 3 sets of 8 repetitions each side. Proper Properly diagnosing a shoulder pain is pivotal in the recovery process. The client understanding they need help is the first step in recovery for their health. It is our duty as healthcare professionals to provide and properly diagnose and help the client recover. The corrective exercise continuum allows for a baseline and steps on how a client can progress their injuries. Thank you for watching.